Elizabeth O'Byrne is getting her gardening done, but it isn't easy.
I don't have my scoop out here.
For the past 19 years, she's suffered from rheumatoid arthritis, which makes doing many everyday things difficult.
My hands hurt, my shoulders, my neck, my wrists do, and they will swell up, and my ankles, and my knees. So it moves all over, and maybe one day your wrist will hurt, and then the next day the other wrist will hurt, or they'll both hurt at the same time, and they'll be swollen. And it does make it very hard to do things. You're really limited in what you can do.
But she knows being active is crucial to her health.
I do have to take care of myself. Plus, I also have high blood pressure, and it's quite high. So I do have to make some lifestyle changes.
Her high blood pressure has put her at risk for heart disease, not uncommon in RA patients.
Rheumatoid arthritis is a chronic inflammatory disease. And we believe that the systemic inflammation takes its toll on the heart and arteries. And so that poses a higher risk of heart disease in many different forms.
Although the exact connection is not known, doctors suspect one link may be that the protein that causes inflammation in the joints may also cause inflammation in the arteries, can raise blood pressure, and reduces the blood flow to the heart. Another may be certain steroids patients take may cause hardening of the arteries or diabetes, leaving RA patients with twice the risk of heart failure than people without the chronic disease. At the Mayo Clinic in Minnesota, they have created a cardiorheumatology clinic and use a specialized imaging technique to catch the earliest signs of trouble.
Speckle tracking echocardiography is a technique using ultrasound to look at the motion of the wall of the heart, and by doing that, inferring if it's functioning normally or not. And they describe that as being strained, and so abnormal strain pattern can suggest a medical disease of the heart, such as poor circulation to that region of the heart or other problems.
Once they identify this pattern of heart muscle damage unique to RA patients, they can start early intervention.
We certainly know that there are always better outcomes if you can identify these disease process early and initiate effective treatments. So that's part of it. So there's primary prevention, so we want to identify people who may be at increased risk and certainly target them for treatment. The other is finding the disease early, so secondary prevention and initiating blood pressure control, lifestyle modifications, certainly smoking cessation is very important, control of cholesterol, and other interventions to minimize the risk of having actual cardiovascular events such as a heart attack or stroke.
When Elizabeth O'Byrne learned she had warning signs of heart disease, she started exercising and becoming more active.
I'm starting to eat more fruit and vegetables, and there's when we go out to eat, I do like to eat certain things, but I am more conscious of it now, so I am trying to make lifestyle changes.
Something doctors say is crucial for every RA patient. Holly Furfer, CNN, Rochester, Minnesota.
Oh, the little hummingbird over there. Yeah.